When we talk about pregnancy, we mostly only talk about how the baby was conceived, the development of the fetus, etc. But we rarely talk about the mother herself who conceives the baby. So in this video, you'll get to know what to expect during the 3 stages of pregnancy and the effects of pregnancy to women. Hi, and welcome to Empowered Pinay. Click the like and subscribe button for video updates. Did you know that there are about almost 300 million sperm cells who tried to make it through an egg cell during the process of fertilization? During the journey of these sperm cells, many dies on the way because of mucus, acidic fluids, and voila! You won! You successfully united with the egg cell. So don't forget how special you are from day one. From this moment on, pregnancy has begun. Usually, it takes 40 weeks for a woman to conceive a child in her womb from the very last day of her menstruation period. Now that you know you're pregnant, here's what to expect during pregnancy. But let me break it down into the 3 categories of early, middle, and late pregnancy, called first, second, and third trimesters. Oh, and before we start, don't forget to go to your OB-gynecologist the soonest you find out you're pregnant. The first trimester. This happens from week 1 to week 13, or the first 3 months of pregnancy. This is also the most crucial to your baby's development because your baby's organs and body structure begin to form during this stage. Physiologically, this is when morning sickness, breast tenderness, food cravings, heartburn, shortness of breath all happen. You also tend to become sensitive to tastes and smell, and you'll also urinate more often. But remember, all pregnancies vary, so some pregnant women may not really experience all these, while some may experience worse than this. While emotionally, you may feel irritated, moody, and exhausted most of the times. This is caused by hormonal changes, and this is completely normal during the first trimester. So I bet your partner will really need to be extra patient during these times. We're now on to the second trimester. Oh, don't be nervous. You'll actually feel more energetic, happy, and healthy during this stage. The second trimester happens between week 14 to week 26. At this point, your baby has grown to around 23 centimeters. More organs develop, and this is also when they start to suck their thumb. They can also already hear sounds at this moment. In your second trimester, major changes in your body will occur. Your uterus is growing, so the ligaments supporting them will also stretch, causing back and leg cramps. Your bones move, you'll feel stomach pain, constipation, and your skin also starts to stretch bigger, causing stretch marks to appear. These may also cause itching. When it comes to the emotional aspect, you'll feel more happy and active. Though the morning sickness, fatigue, and moodiness fades, anxieties are more likely to happen during these times. Some mothers also experience having depression and anxiety disorders. Feel free to always call your doctor whenever you're worried about your emotional state. You have now reached the final stretch of your pregnancy. The third trimester happens from the 27th to the 40th, or sometimes up to the 42nd week. The baby in your tummy now weighs approximately 2.6 kilograms, and your tummy will probably be the same size as a big watermelon at this point. The baby's lungs are also more mature by this time, and they also begin to position themselves head down. The expansion of the uterus press on veins, causing fluid accumulation in the legs and feet. This is why swelling, or manas in Filipino, happens to pregnant women in the late pregnancy. At this stage, you'll also get tired more easily due to sleepless nights and shortness of breath. You'll also feel pressure in your lower abdomen as your baby gets ready to come out. The worries and anxiety you get as you are nearing the big day, or How you will manage as a mom will all be normal at this stage. Also, the difficulty in sleeping might trigger your mood changes and irritability. However, most women find this stage very exciting, and the idea of finally giving birth puts them in a lighter and brighter aura. Finally, the day has come. It's now time to push the baby out. Ready your stuff and get ready to push. Or get ready for the slicing too if you prefer the C-section rather than the normal delivery. You might also unexpectedly undergo C-section if the doctors see fit. We'll make a separate video about the normal delivery and cesarean section in the next few weeks, so better stay tuned. Let's now go to the aftermath, or the after effects of pregnancy to women, so we won't also ignore the aftercare. Yes, we're not done yet. Now that you're a mother, we'll get to understand how the pregnancy has affected you holistically. Physical effects. Abdominal cramps. Your uterus contracts and shrinks back to its normal size. It can cause some lower abdominal cramps. Cup size. We get a lot of misconceptions that when women get pregnant or becomes a mom, their breasts will get bigger, especially if they're breastfeeding their babies. But according to doctors, after you give birth and stop breastfeeding, women's breast can be saggy and smaller than it usually is. Menstruation. The first few periods after delivery may be irregular and heavy. Some breastfeeding moms may not have periods while breastfeeding. If they're not breastfeeding, their period might get back 6 to 12 weeks after they have delivered their child. Belly bulge. You might actually still look pregnant even after giving birth because of the post-baby belly, or what we also call the belly bulge. It usually takes 6 to 8 weeks before the womb comes back to its original size, causing your lower stomach to bulge. Hair loss. We may think that we lose too much hair after we give birth, but the truth is our hair grows thicker and fuller while we were still pregnant, so it just all evens out and goes back to normal, so don't worry too much about this. Constipation. Your first bowel movement after you give birth may be delayed for about 3 to 4 days, so be ready for this. Perspiration. Once your delivery is over, you'll be experiencing more night sweats or chills, and perspiration will be increased as well during the day. This is because your body is adjusting to the new hormone levels. Don't forget to be hydrated when this happens. Vagina. If you had a normal delivery, your vagina will be naturally swollen, sore, and more stretched, but this will change over the next few weeks. Mental health effects. Postpartum depression, anxiety, obsessive-compulsive disorder are only some of the mental health disorders a mother can experience from giving birth. This happens mainly due to hormonal changes, which can also contribute to sadness, irritability, mood swings, etc., or what we also call the baby blues after giving birth. Not only that, the hormonal changes actually also affect your bones. Since the joints become loose while you were pregnant, it may take time for your joints to return back to its normal state. On top of all these, you may feel very anxious and emotional as well because of the changing hormone levels. These are just normal and can last a few weeks, but if it seems to be getting worse and longer than usual, consult a doctor as you please. Moms sure go through a lot from the very first day, so make sure you give them the right amount of love and support. That's it for today. Who do you think needs to watch this video? Share them now and click the like and subscribe button. Again, this is Empowered Pinay saying, let's be empowered together and let's empower Pinays and women together.